Vitality, joy, and ease. That deep breath that tells you you're safe. The warmth of an embrace that lands not just on your skin, but somewhere deeper. That quiet confidence that comes with a body that's rested, nourished, and at home in itself. These are the hallmarks of profound mental health. And historically, these were exactly the things that we were most suspicious of. For over 25 years, I was a somatic therapist, and I loved working with people, especially those with trauma and complex PTSD. I loved helping them discover or rediscover their capacity for all of these qualities, this state of embodied well being. I celebrated each of their victories, and I was often bewildered, sometimes hurt by colleagues that looked at my work with deep suspicion. Because in the larger clinical community, there is an almost primal aversion to somatic work. Touch, especially, is highly controversial. In this video and the next, I want to do something a little unusual. I want to explain both why somatic work is so highly helpful, even essential, I believe, to healing, and why my colleagues are absolutely right to fear it. Because the history of what has been done in the name of the body for sanity's sake is very dark indeed. Before therapy learned to talk, it worked on the body, and it did not go well. Let's start somewhere infamous, Bedlam, otherwise known as Bedlam Hospital in England. At this time, madness was seen as a problem of the body. Its humor is unbalanced, the system's malfunctioning, and so the body needed to be fixed, sometimes gently, often not. Patients were strapped into rotating chairs and spun until they lost control of their bowels, an intervention believed to reset the nervous system. Others were submerged in icy water to shock them back into reason. Bleeding, purging, blistering, these were standard treatments. The body was seen as dangerous, even animalistic, something that had to be dominated into submission. And the fear didn't just live in hospitals, it lived in our stories. In Dr. Jekyll and Mr. Hyde, Robert Louis Stevenson captured the cultural anxiety perfectly. Reason versus instinct, mind versus body. And when the body is unleashed, it doesn't lead to joy. It leads to brutality, madness, and murder. So when Freud arrived, he did something radical. He moved therapy into the mind. At first, though, Freud still touched his clients, little known fact. In the 1890s, he used what he called the pressure technique. He would place a hand gently on the forehead and ask the patient to say whatever came to mind. It worked, and that was the problem. Freud abandoned the method not because it failed, but because it worked too well. It increased suggestibility, it intensified dependency, it blurred the already fragile boundary between authority and influence. Most concerning of all, it amplified transference. Patients started seeing their analysts as their mean mommy. He decided it was too powerful to use without destabilizing both patient and analyst, and history quickly proved him right. Several of his proteges engaged in affairs with patients, and some of them even married former patients. Erotic transference was framed as inevitable, even therapeutic. So the field did something understandable. It shut the door. Touch was banned, not because it was trivial, but because it was dangerous, because power without ethics had already caused great harm. The body became a Pandora's box. Open it, and no one knew what might come out. Psychoanalysis became the gold standard for treating depression, anxiety, and obsession. And yet, the urge to return to the body never fully went away. When the body re-entered psychotherapy, it didn't do so quietly. Many pioneers cracked something essential open. Breath, movement, touch, and enormous controversy. Others crossed lines that should never have been crossed. The result was insight, yes, but also harm. Rather than slow down and mature the work, many of the field participants pulled away entirely. Somatic therapy became labeled fringe, not because it lacked power, but because power without containment is dangerous. In the 1940s, Wilhelm Reich believed he had found the answer in orgone energy. Building boxes meant to restore vitality, to unblock bodily flow. At the same time, lobotomies became mainstream psychiatry. Thousands performed every year. Why? Because the alternative was worse. Institutions were violent, overcrowded, and dehumanizing. As one neurosurgeon later recalled, lobotomy seemed like mercy compared to a sentence in an asylum. Some patients improved, many did not. By the 1950s, lobotomy faded into history. Its creator awarded a Nobel Prize, its human cost quietly absorbed. Reich, too, ended up badly, dying in prison after the FDA declared his devices fraudulent. So here we are, between torture and silence, between uncontained bodywork and disembodied talk. There had to be a better way. A way to work with the body without harming it. A way to open the Pandora's box slowly, ethically, and with care. And that's where the next chapter begins. Stay tuned.